My name is Ken Cutbush. I'm a shoulder surgeon working in Brisbane. I'd like to talk to you about reverse shoulder replacements, in particular, what to expect after the operation. So a shoulder replacement is like a hip replacement or knee replacements. It's a substantial open operation, and you need to think about it before going into a shoulder replacement. You need to think about it quite carefully. There's a lot of preparation, and you do need to know what's going to happen in terms of the rehab and what to expect post-operatively. So you'll come in on the day fasted. The anaesthetist will put a needle in your arm and give you a general anesthetic. You'll be out to it for the operation. We book about 3 hours of operating time. We won't need all of that for the operation. It is an open operation. You will then be in recovery for about an hour afterwards, and you'll be on the ward for 2 nights typically after the operation. The first morning you'll go down for an x-ray and a CT scan, and you'll see the physiotherapist. The physiotherapist will start you on my rehab program, the post-op protocol, and then day 2 you'll see the physiotherapist again. Of course, I'll check the x-ray and the CT scan and make sure that I'm happy with the position of the prosthesis and the way everything's looking and the way it's all sitting. And you'll get out around about 10 o'clock or 10 a.m. on that second day post-operatively. You're going to be in a sling for 3 weeks following a reverse shoulder replacement, and then we'll be asking you to wean out of the sling over the 4th week, and you'll come back and see me with one of the shoulder physios at 6 weeks and 12 weeks post-operatively. At 6 weeks, things are normally a little sore, a little achy still. You haven't got your range of motion back, and we start you on an increased or a graduation in terms of your rehab program with the physiotherapist. And we'll feed back to your physiotherapist so that everyone knows what's going on and stays in the loop. At 12 weeks post-op, normally things are pretty good in terms of range of motion, and you're doing your day-to-day activities at home. You're starting to re-engage in your little sporting activities, maybe a bit of golf, certainly walking, maybe a bit of swimming at that stage. And if you're working, you'll be looking at going back to work at that stage, particularly if you're doing desk work, admin type work, but you wouldn't be back on the tools until at least 6 months or 12 months post-operatively. You then, from that 12-week point, you typically don't need to come back and see me until the final review, which is at 12 months post-op. And over that period of time, you'll be increasing your rehab with the physiotherapist. And at 12 weeks, what we start you on really is more strengthening. That's the focus of the rehab program, changes from regaining your range of motion towards getting strength in your shoulder. At 12 months post-operatively, we'll see you back with a CT and x-ray, and what I want to see then is that the prosthesis is well seated, and that we've got ingrowth, that the prosthesis has been bonded to, and that everything's sitting in the right position. And from there we can expect or anticipate that you're going to have a good long-term outcome and everything should be right. These prostheses should last 20 years or longer, and that's what we're seeing in the Australian Joint Registry.